We're going to get started in just a moment. Thanks everybody for joining. We're going to get started real soon. We're just getting everything set up. Hey, Ashley. Hey, Tom in the building. Thanks for joining. Okay. It's 7:13. So since it's 1913 and we got the Deltas in the room, we're just going to go ahead and get started. So thank you everybody for joining. This is Cannabis Journal Club. I'm Dr. Moore. I'm the medical director at Dr. Damas Wellness. Dr. Damas is going to be joining us shortly, but we're going to get started. And today's journal topic is cannabis and CTE. All right, cannabis and CTE. So if it's your first time joining us, thank you so much for joining. So a little bit about Cannabis Journal Club. What this is a way for us to bring the evidence-based medicine regarding cannabis to the people, to the patients, to anybody who's interested in learning more about cannabis and its medicinal uses. You're gonna hear us say this a lot, but the cannabis has had a bad rap for a while, right? And because of that, there's a lot of misinformation, there's a lot of disinformation out there, and a lot of people don't really know the ways cannabis can be beneficial. So we're gonna talk a bit about that. And the way that we do this is we pick a topic that is interesting to us or interesting to the patients, and we find a journal article that talks about it. We read that article, we break it down, and we try to share that information with everybody in a way that makes sense, right? So we're going to translate the medical jargon into some stuff that everybody understands. At least I'm going to try my best, all right? And please, if you have any questions or if anything's confusing, if I go too fast, just let me know. I appreciate the feedback, all right? So we're gonna go ahead and get started. So today's topic is cannabis and CTE. So CTE stands for chronic traumatic encephalopathy. Chronic traumatic encephalopathy, okay? And that's a neurodegenerative brain disorder that we think is caused from repeated head trauma. So we're gonna break it down. So chronic means that it's the opposite of acute. This is not a condition that you get quickly. This is not a condition that comes and goes away quickly. Chronic means it's there for a long time, okay? Neuro, meaning that it has to do with the nervous system. In this case, we're talking about the neurons in the brain. And degenerative, meaning deterioration over time, deterioration of tissues over time because of wear and tear, age, and in this case, trauma. So an encephalopathy basically just means a brain disorder that alters the normal function of the brain. So CTE, or chronic traumatic encephalopathy, is a neurodegenerative disorder that is caused by repeated head trauma. So what are the symptoms of CTE? The symptoms of CTE are broken into three categories. All right, so neuropsychiatric, cognitive, and motor. So neuropsychiatric is things that have to do with your behavior and how your brain affects your behavior. A lot of times these are the earliest signs of CTE, and these are the things that first get family members, friends, or sometimes even the patient concerned enough to go see the doctor. And we're talking about things like changes in personality, becoming more impulsive, maybe starting to become more aggressive or violent. A lot of times people who were really calm and docile turn into really impulsive and aggressive type of people. A lot of times these symptoms kind of mimic other psychiatric disorders like depression. So people with some of the neuropsychiatric symptoms of CTE might show symptoms of withdrawal, like people who are depressed, or the impulsivity of somebody with bipolar disorder. Or not delirium, but the paranoia of like a schizophrenia. So those are the first kind of symptoms that you might see. And the next group of symptoms we're going to talk about, the next category of symptoms is cognitive. So cognitive symptoms, these are the ones that talk about how your brain is functioning, how well your brain is functioning. So the cognitive aspect is things like memory impairment and inability to focus and concentrate, inability to plan, And the last group of symptoms is the motor symptoms. So this is movement, right? So you'll see things like people having decreased coordination, difficulty walking, becoming more clumsy. You'll even see things like Parkinsonian type shakes, right? All these things are common motor symptoms of somebody with CTE. Now, just to paint the picture and show you how devastating of a disease this is, if you're not already familiar with it, I'm going to use Muhammad Ali as an example. And I want to give a disclaimer that to my knowledge, Muhammad Ali was never definitively diagnosed with having CTE. He definitely had Parkinson's and Parkinson's-like movements with the shakes, but he has a lot of those same symptoms of somebody with CTE. So we're going to look at the juxtaposition of Muhammad Ali early in his career and Muhammad Ali closer to his death. So Muhammad Ali, you got somebody who's got a great personality, very outgoing, super smart, sharp as a tack, right? Like this guy's doing commercials, interviews, he's talking trash in the ring, right? He's very bright. You know, this guy can tell you about fights that happened every round, you know, blow for blow. He's floats like a butterfly, stings like a bee, right? He's super fast, he's super quick hands, quick feet. That's why he was one of the greatest. And then compare that to how Muhammad Ali looked in the later years of his life. He didn't have that outgoing personality anymore, right? He wasn't able to talk in depth and talk about things from memory the way that he used to. And he definitely had those kind of Parkinsonian type movements. You wouldn't imagine Muhammad Ali in his 60s, you know, even playing around, sparring, throwing a jab, right? So even though this wasn't officially diagnosed, he's got a lot of symptoms that look, or he had a lot of symptoms that look a lot like CTE. So you're taking people that are some of the most elite athletes in the world, for example, and reducing them to somebody who can't even control their own gait or feed themselves. So who gets CTE and how do you get it? So, you know, everybody, I think most people know about CTE from the NFL, but before CTE even had the name CTE, it was called punch drunk or dementia pugilistica. So they've known about this for 100 years. In the 1920s and 30s, they called it punch drunk, and you would see it in like old retired boxers. You know, back in those days, there wasn't much that was done about it. It's kind of like, all right, well, you know, you boxed for 20 years and now you can't talk normally anymore, or now you got memory lapses. They didn't do the research to figure out, you know, what it was behind it and if there was any way to treat it. So it kind of sat there. It didn't. ¿Cómo lo ves ahí a los programas? It kind of pressed, it kind of noticed that it deserved until the I think it was the early 2000s, right? And if you've seen the movie Concussion, if you're familiar, you got the football helmet there. If you've seen the movie Concussion starring Will Smith, he played the pathologist that was doing the autopsies on some of these old players, and he was looking at their brains, and he was noticing that some of these brains of these, you know, 40, 50-year-old people were looking like the brains of 80-year-olds. They was noticing all this brain damage. And if you haven't seen a picture of a brain with CTE, I would highly suggest that just Google it. Google brain with CTE compared to normal brain, and look at the difference in the two. So, you know, the NFL became like associated with CTE, and for good reason, right? Some of the data suggests that there's on average about a half a concussion, like 0.4 concussions per NFL game. So if you take that out amongst all the regular season games, all the playoff games, we're talking about something like 200, 300 concussions in the NFL season. And that's just the regular season and playoffs, and that's just games. That's not including practice.
You're going live.
Oh, my bad, I needed to accept. All right. Okay. We accept. You coming in? We got Dr. Damas in the building, y'all. There he is.
What's up?
There he is. All right, so everybody, Dr. Damas, the president and CEO of Dr. Damas Wellness. with us in the building. So we're talking about CTE, and we just got to the part where we're talking about the NFL. So we already talked a little bit about what CTE is, chronic traumatic encephalopathy. It's a chronic neurodegenerative disorder that comes from repeated head trauma. You know, we talked about boxers and how they call it punch drunk, and we talked about Muhammad Ali. Was there anything that you wanted to add before we got onto the NFL and how they really brought CTE into the forefront?
I think you made some good points with respect to the lack of acknowledgement that this was a severe pathological condition in people, right? So, using a term like punch drunk or something, it's kind of like, hey, whatever, it's not really that important,
Very dismissive.
Yeah, very dismissive. And, along with it, I know you're going to talk about some of the signs and symptoms, but we started seeing these things early on in these combat athletes or combat sport athletes. And then the notion that they described it as punch drunk really tells you that even though it was, they were being dismissive of this, there was an understanding that the force of the blows to the head, what was the reason or the causative effect, the causative kind of insult to the head that was causing the manifestation of these constellation of symptoms, this punch drunk thing. And then we started seeing this in other sports later on. Now we're at the NFL level. So excellent.
So, the NFL, it became almost a scandal with the NFL. And, they went back and forth, but because of it, oh no, let me go back. We were talking about concussions, right? So the number was something like 0.4 concussions per NFL game. I think there were 229 recorded concussions in the 2019 NFL season. And those are recorded concussions, and those are concussions that happen during games. We're not talking even about preseason, and we're not talking about practice, right? But 229 concussions that happened during one football season, just in games.
Practice.
Talk about
practice.
So, but I mean, I don't know how hard y'all were going in the Bills in practice, but you out there, people out there trying to make the team going full throttle, right? And there's a lot of head-to-head contact. And back in those days, we haven't gotten into the rule changes that the NFL has created, right? So fast forward to after the whole scandal came out with the concussions and the NFL, and now you got these rule changes to try to protect players, right? Where you get penalized if you lead with the crown of your helmet, right? They've got these targeting penalties in college. I think they have something similar in the NFL, but the whole idea is to try to limit these really violent head-to-head hits that cause these concussions. Now, the problem is though, you're looking out for, or you're changing these rules to limit the head-on-head contact that's going to cause these concussions and like knock people out, but it's not addressing the subconcussive injuries, right? Like every time two 300-pound linemen line up across each other and hit each other like that, like that's like a mini car accident happening. Like these are the biggest, strongest people in the world bumping heads for 60 straight minutes, right? And that's going to cause a little bit of head trauma. Now we're on the lookout for concussions, and we're talking about the NFL, and they initiated the concussion protocol, right? So they didn't have that when you were in the league, but now they got the concussion protocol where if somebody looks like they've been concussed, they get yanked out of the game, right? They get yanked out of the game. They get evaluated by the team physician, a neurosurgeon, and they're not allowed to They get cleared that same game. It's not really a concussion. Go back and finish the game, or this might take several days, several weeks, even longer for people to recover from these concussions. And when we're talking about concussions, we're just talking about a head injury that's severe enough to either make somebody dizzy, to see stars. It doesn't necessarily have to be something that knocks somebody unconscious, right?
Nausea, hearing changes, getting your bell rung when you're hearing things, double vision. So all these kind of things were at some point, like you said, they weren't actually being diagnosed as concussions, just, you know, part of playing the game. He got his bell rung. He'll be all right in a little bit, right? And we now know that that was actually a concussion. It just wasn't a blow that was concussive enough to force loss of consciousness, you know, or gait abnormality or something like that. But it was enough to alter your normal functioning.
Exactly. And so, you know, the NFL they're trying to limit those big hits. They're trying to be on the lookout for folks, you know, who have concussive type symptoms during a game. But again, the problem lies in there's no max amount of concussions that you can have before somebody steps in and says, hey, you can't play anymore. So, you know, the NFL is trying to do what they can to limit these repeated head traumas, but we still have a long way to go. And you know, it's not just the NFL either. Let's stay on top of the football for a second before we move on to some other stuff. But it's not just NFL football. There have been studies that show that people who've played football at all levels, starting from high school, have shown evidence of CTE. So, you know, it gets more severe both the longer you play and the higher level of play that you're at. Obviously, more years of getting hit in the head is going to have more of an impact, and getting hit in the head by people who are bigger, stronger, and faster is going to have more of an impact. So what we're seeing is that the people who had CTE, who only played high school football, for example, it was more mild, but still seeing these brain changes, right? The most severe cases of CTE were those who played, you know, multiple years in the NFL. But it's not just NFL, right? It's not just football, right?
Correct.
It's other sports that can cause these repeated head trauma. So basically, any sport that can cause a repeated head trauma can put you at risk for CTE. So we're talking about hockey, obviously. We're talking about lacrosse. We're talking about wrestling, and even talking about soccer and headers in soccer. You might not think that that's can cause an injury to the head, but you know, you're hitting a ball that's coming at you with a lot of speed, and you're slinging your head at it as hard as you can. You know, you do that enough times, you know, that kind of those mini traumas can start to add up. And
Definitely.
You told me about an interesting case that I didn't even know that this sport was on the radar for CTE.
Correct, right? So we found out recently, we just came across this knowledge, but it's not new knowledge, that volleyball players were at risk for, suffering from the effects of repetitive brain damage. Who knew that, right? It's not my space. It's plenty of us don't know this space. It's kind of like the same thing with soccer until somebody really breaks it down to you and says, well, you know, you're bouncing your head off this hard ball at this certain velocity over time. It can cause damage. But volleyball, they get the same thing. You know, there's certain sets of drills that they do where they're actually, you know, trying to block or spike the ball, and they're getting hit in the head with that, right? And in certain times too, they dive on the ground, hit your jaw, you get the counter croup injuries. And so those things happen over time. And you're looking at this, like, you know, this kind of large group of sports where you have these violent collision sports on one end, what you thought would be non-violent, non-collision sports on the other end, but still having these, you know, symptoms or symptomology of some sort of brain injury. And as physicians, as medical professionals, you know, one of the things that you want to do is understand why. And going full circle, why are you punch drunk? Because you got punched in the head, right? Well, what was the thing, you know, in football, we know you're not getting punched in the head. You're actually banging heads, right? And boxing, MMA, you know, there's fists and knees involved, right? Lacrosse, there's the ball, there's actual collisions, and there's the what do they call that? The stick.
I don't know what
I think it's called stick. Yeah, I would call it the stick. I think that's what they call it. All right, you know, soccer, you have the ball, and then now it starts to make sense that your brain really shouldn't be. That's why it's encased in the skull. Right. It's literally encased in the hardest thing that your body can do to keep the most precious thing. And here we are engaging in activities where we're like, now we're gonna bang this thing around and see what's rattling inside of there.
And see what happens, exactly.
Yeah.
And you know, and then the other The other really unfortunate place that we're seeing a lot of CTE is in the military theater, you know, especially amongst those who've been deployed and may have been exposed to like blasts and things like that. You know, even if you don't come home with any other injuries, just getting, you know, hit in the head, even with a helmet on, getting hit in the head, you know, by a piece of shrapnel or something like that, you know, it can cause a traumatic injury that can then lead to CTE. So now that you guys know what a little bit about what CTE is, I'm gonna talk about how to diagnose CTE. And this is one of the sad parts about this is that CTE is a diagnosis that's made postpartum. So it's a diagnosis that's made after people have died, and most times they donate their brain to science where an autopsy is done, and the pathologist or medical examiner or whomever will look at the brain under the microscope, and they'll be able to identify these certain proteins that are specific for CTE. They're called tau proteins, tau amyloid proteins, and it's very similar to Alzheimer's disease in the way that these proteins cause these tangles inside the brain and prevent the brain from functioning normally, prevent the normal communication between different neurons in the brain. And it's all because of these tangles. But unfortunately, you know, you can't look at somebody's brain that way while they're still alive. So unfortunately, you know, this is a diagnosis made after somebody dies. Now, the first question that a lot of people are probably going to have is, well, what about imaging? What about a CAT scan or MRI? You know, right now with the technology that we have, we don't have the capability of specifically looking at an MRI and saying, yeah, this is CTE. There's a lot of different brain disorders that resemble CTE on imaging, and you just can't, you know, you can't tell to make the diagnosis. Furthermore, the way that Alzheimer's, for example, is diagnosed is, you know, you've got a set of criteria. It's a set of symptoms, and if you meet those diagnostic criteria, it's Alzheimer's. A lot of things are, you know, you got to rule out certain things. You know, is the brain changed because of medication or because of other things? But you can at least diagnose Alzheimer's based on the symptoms that they have. We don't have that yet for CTE. So it's really hard to officially diagnose somebody with CTE while they're still alive. And if you can't diagnose somebody, it's really hard to treat them.
Right.
So,
correct, because there is such an overlap. There's such a broad spectrum of manifestations in it, from behavioral, you know, to motor, to neurocognitive, neuropsychiatric, to you know, emotional, right? So each one of those things by themselves, they don't all need to happen. So it could just be a person who becomes depressed, right? Or develops some sort of social phobia and becomes what we call a shut-in, right? Like that in and of itself would be hard for you to diagnose someone with CTE because they manifested that unique symptom as opposed to all the others, all right? So it's hard to do that, even given the history of participation in certain activities. And even if you had 2 or 3, you know, this person had behavioral changes, appetite changes, memory loss, you know, even that, because there are other things that could, you know, there are other diseases that can manifest in the same way.
right.
So it's hard to exclude all these other things, which is what makes this very difficult to diagnose in vivo while someone's alive.
Exactly. And, you know, part of the reason, you know, and that goes to part of the reason why, well, we're going to talk about treatment, right? So the next question is can it be treated? How do you treat it? And of course, the reason why we're all here is what role, if any, does cannabis play in the treatment of CTE? So another sad truth is that there's not a treatment for CTE. There's not one treatment that actually treats the cause of CTE or the actual pathology of CTE. We talked about those neurofibrillary tangles. There's not a medication that reverses that or halts that, right? So the treatment strategies basically are, you know, there's memory exercises, there's cognitive and behavioral therapy where you go talk to a therapist and, you know, work, just doing talk therapy and different exercises to work on keeping your brain sharp and training. And as far as medications go, the medications that we use for people with suspected CTE are Alzheimer's medications, right? They're schizophrenia medications. What else? There's another, and of course, you know, Parkinson's medications. Yeah. So we're basically using what we can to treat the symptoms of CTE that resemble other things that we do have a treatment for. So it's suboptimal. And that's why we're here talking about, can cannabis help? Now, the answer to that is yes, it can. And I'm going to tell you why. And it can help in two ways. If you were here for the science of the high talk that we did on 420, we talked about how we're going to use this word cannabinoids. So cannabinoids there are two types of cannabinoids: phytocannabinoids, which are the ones that come from a plant, and endocannabinoids, which are the ones that come from our body. And a cannabinoid, an example of a phytocannabinoid is everybody's favorite, say it with me at home, THC. THC. Exactly. So that's an example of a phytocannabinoid. CBD, also a phytocannabinoid. Now, these cannabinoids interact with these receptors, and we got them all in our brain, we got them all over the body. Now, when they interact with these receptors, they cause a whole host of different neurotransmitter release. And we're talking about some of these medications, like for Parkinson's, for example. The Parkinson's medication is levodopa carbidopa. And what that does is it helps release dopamine, which helps decrease the symptoms of Parkinson's. Cannabis helps release dopamine. That's one of the things that cannabis does, right? So also for, you know, for people with CTE who are presenting with anxiety and things like that, you know, and depression, you know, cannabis upregulating the GABA receptors or increasing serotonin release. If you remember, serotonin is the neurotransmitter that's associated with pleasure. It's the hedonistic neurotransmitter, the one that makes you feel all good and warm when something good happens to you. Those are the medications that help release serotonin are used a lot in anxiety and depression. And so cannabis can help release serotonin and treat some of those symptoms. So cannabis has been shown to treat a lot of the different symptoms of CTE, and that's great. You know, that's the best we got so far as other medications that are already on the market. But the thing that makes cannabinoids special is that they're also neuroprotective. So
what does that mean?
So exactly. So
break it down.
So it's basically it's just a way of saying that they can protect the brain from injury. And I'm gonna talk about a couple of really, really interesting studies that show how cannabis protects the brain. So there's one study I came across. It looked at 400 plus, like 446 trauma patients that came into the trauma bay, and they all had head injury, traumatic brain injury. Okay. Now, whenever these patients came in, they did a toxicology screen. So they either tested the urine or the blood for whatever different types of illicit drugs they could find. What they found was that there was a statistically significant improvement in survival of the patients who had cannabis, THC, in their system compared to those who didn't. And we're not talking about, you know, these people were smoking weed and then they got into a car crash or whatever. And that's, no, you know, cannabis, THC stays in the system for, you know, it's stored in the fat, it stays there for a while, right? So people who had THC in their systems at the time of the crash, whether they were acutely, you know, high at the moment or they had smoked days prior, they had a better survival benefit than those who didn't, which I thought was just mind-blowing, right? So the next question is, well, why? How? Right? So going back to the father of cannabis medicine, Raphael Mechoulam and his crew, they did a study looking at the actual way that cannabis can be neuroprotective. And what they found is that in response to trauma, the endogenous cannabinoids, the endocannabinoids, they saw an increase in the release of those. So when the body, question, yes.
I got a question. All right. So you said phytocannabinoids, right? And endocannabinoids, right? So So where do I find the endocannabinoids? Just for the crew at home here, just for us mice over here, right? Where do we find the phytocannabinoids, and where do we find the endocannabinoids?
Well, you can find the phytocannabinoids. Actually, we've got some phytocannabinoids right here at Dr. Dominus Wellness. So, of course, we sell, in addition to helping patients who have a qualifying condition get their medical marijuana card, and that's one of the places you find phytocannabinoids is within the actual marijuana, the one with the high THC, right? And then the other place is in CBD. So those are the two most common phytocannabinoids. The endocannabinoids are produced regularly in our body, all over the place. They're produced at the gaps between two neurons, and they're released by the postsynaptic neuron in order to affect the presynaptic neuron. So when the brain, so going back to what we were talking,
you blow.
Exactly. So going back to what we were talking about, and this is the wild thing, in response to brain injury, whether it was traumatic, whether it was ischemic, meaning like from a stroke, they observed the brain releasing the endocannabinoids. There was a spike in endocannabinoid release in response to brain injury. So what's that about? That must mean something. The body's releasing this for a reason, right? And what they found was, in a very similar way that cannabinoids help to deal with inflammation and to deal with immunity, they helped to kind of modulate the amount of brain injury that happened after, or secondary brain injury that happened after a traumatic insult to the brain. I feel like I gotta take a second to explain this for a second. So there's two things that happen, at least two things that happen when you have a brain injury. The first is the initial hit, boom. You hit in the head, blackout, or whatever part of the brain that got impacted the most. Actually, if you get hit on this side, it might affect you more on the other side. But there's that initial injury, and then the secondary injury comes when the body senses that injury and starts to release all of these different molecules to come check out what's happening, and the inflammatory process starts. So remember, the inflammatory process, most people think of it as a bad thing, but the inflammatory process is really, it's the way that the body activates the healing process, right? But the problem with the inflammatory process is that it can get way out of hand. It can do too much, right? So we talked about with cannabis and inflammation, how cannabis can tell some of those inflammatory cells like, yo, you gotta chill, or we got enough of your type of cell here. We don't need you. We'll let you know. Okay?
Yeah, we got enough here. Listen, there's too many of y'all in the club. We're not letting you off. Like, we got a strict dress code tonight. I'm sorry. You can't come in there with those Timbs, because we know that dudes that come in the club with Timbs act a certain way.
That's right.
We don't want y'all. Yeah, we don't want y'all in here tonight. You got to chill out, right? So that makes perfect sense.
So that's exactly what these cannabinoids were shown to do in inflammation, in immunity, and they do the same thing for brain injury. I'm not going to get too much into the biochemistry, but there are two things I want to talk about that you see with brain injuries and then the inflammation that comes. So we talked about, so the first part was the hit that happens. The second part is when the body activates that inflammatory response. And you see these free radicals or reactive oxygen species. And then you also see glutamate. These are just normal parts of the brain's inflammatory response to injury. Now, cannabinoids will limit the impact of the glutamate on the brain tissue. And like I said, it'll also kind of put those other cells, they're called microglia, it'll put them in check so they can't come in and increase swelling and do things like that. It modulates the inflammatory process so that you get the benefits that the inflammation brings. You get the whether it's starting to heal or just prevention of inflammation going out of control. The cannabinoids can, that's their function in response to brain injury.
So let me try to tie this together, because you mentioned two studies, right? One that dealt with survivors of had an increased survival rate because in their blood work, well, not because, but as an aside, right? They found that in their blood work, high levels of THC, which is a phytocannabinoid, right? And that, in that population that was in these accidents, those people with phytocannabinoids, high levels of phytocannabinoids in their system, had a greater survivability rate. And then Meshulam et al. Had their study where they found that during instances of brain injury, the brain secretes a large amount of endocannabinoids, right? Two different categories of cannabinoids, phyto from outside and endogenous or endocannabinoids, but from both studies show that they may have some sort of protective property.
Exactly.
Right? So I would say two different ways to get it, right? One you either produce yourself, or one that you're getting from an outside source, right? And they both serve the same function. That's what we're saying here. And that function is protecting the brain from injury, decreasing inflammation, decreasing cytotoxicity, or the results of your body's reaction to the insult.
To the initial injury, exactly.
Very nice.
Because, thank you for summarizing that. But because Brother Meshulam was a G, he didn't just stop there and look at the endocannabinoids. They found that when they were looking at lab rats here, when they gave the lab rats either a molecule that would prevent the breakdown of the endocannabinoids, or they gave them a synthetic cannabinoid, they noticed that you got the same properties. You got the same way that the endocannabinoids help to prevent the secondary brain injury. It was the same way that the synthetic cannabinoids would prevent the secondary brain injury. And that is what brings us back to that original study that we talked about, where giving somebody some type of cannabinoid, whether in that study it was mice or rats, and it was a synthetic cannabinoid, but and more research needs to be done, obviously, but what it's showing us is that there is a potential that having cannabinoids in your system, having an additional amount of cannabinoids in your system, or being able to activate your cannabinoids on demand, is actually neuroprotective. And in this case, we were talking about traumatic brain injuries from car crashes, but doesn't it make you curious as to whether it would prevent traumatic brain injuries from other things like bumping helmets with somebody, you know what I mean? Or getting hit in the head with a volleyball. I mean, so this is where the science is pointing us to. Those next research studies haven't been done yet that actually say, okay, let's go ahead and administer some phytocannabinoids to these patients who are boxers or football players or whatever, and let's look at whether it actually is neuroprotective in these people. And we're talking about as a prophylactic measure, like having this stuff on board from the jump, preventing things from happening. So
I was going to tell you anecdotally, I know a lot of dudes that I play ball with that smoke weed, and this is from way back in the day, and we've heard it a lot from a lot of, especially football players who are out in front of this saying, I do this because it helps me feel better. Like my mind is clearer, I think better, my headaches are gone, and those type of things. So we've heard this from, a lot of these athletes for a long period of time. We have a lot of MMA guys, Nate Diaz, the Diaz boys are really doing, a lot of other guys, they're even now taking it upon themselves to smoke after the fights. If you see that, some of them will be like, either CBD or THC or combination, and are self-medicating and finding and reporting, like, you might think that I'm doing this to be high, but I'm really doing this because it literally is helping me feel better. In case you didn't notice, I was just fighting a dude in the cage with my fists for 25 minutes, like in case you guys didn't notice what was just happening to my head.
Yeah.
This stuff helps me, right? And so the prohibition has like really done a disservice to the population as a whole, because it has limited the scientific database or the knowledge base on these really important subjects.
Exactly. A lot of room to contribute to the science. There's a lot of things that we have to figure out, but we're in really exciting times here. So we're just on the cusp of finding out what all cannabis can really do. But if we're doing these journal clubs and we're talking about different different conditions, so far I don't think that we've talked about any that are specifically on Florida's qualified condition list. I don't think. But
we do have a question.
Oh, do we?
Someone has a question for you.
All right. I want to.
Yeah, go ahead. It's going towards the direction that you're going in, I think.
Okay.
Because it's asking, can you treat Alzheimer's with cannabis as well?
Exactly.
Right. So I was feeling you.
Yeah.
I felt you right there. Right there. It's kismet. It was like, so can you treat Alzheimer's with cannabis as well, since the brain shows the same damages with CTE as they do with Alzheimer's?
That's a great question. And the answer is yes. Alzheimer's is actually one of the qualifying conditions here in the state of Florida. So we can absolutely treat Alzheimer's with cannabis. Again, there are a lot of studies that need to be done in order to figure out exactly the right dose. Is it CBD? Is it THC? Is it a combination of the two? How often do we need to do it? Should we do it at the earliest signs so we can prevent it? Or, should people with Alzheimer's smoke every day or ingest cannabis every day to prevent the progression of it? We have so much room to find out how it can be beneficial, but we know that it is beneficial for treating the symptoms. So yeah, and on that same note, although you technically cannot diagnose CTE while somebody is still alive, I think it's a safe bet to, if there were a patient who was concerned about CTE, I think that would count as a qualifying as a condition in the same kind or class as Alzheimer's. So wait,
it's Parkinson's.
Oh, Parkinson's. Sorry, Parkinson's.
Yeah, but same kind of class. Yeah. So the interesting thing is, and you got me thinking here, is like going back to CTE, we can't diagnose it, right? But we have all these things that we know can manifest. And it's amazing that no one, in the neurology or the psychiatric worlds have come together and say, we could probably create a checklist and say, medical history of exposure, right? Like medical history of brain trauma from sports participation or military, whatever it is, right? And then we have, all these other things that we can say, have you experienced depression, anxiety, insomnia, mood swings? You can even have family members, because the family members oftentimes are the people who are watching this. The wives and the caregivers are the ones that are watching these changes take place in this person, because the person themselves are not really aware of it, right? For a lot of the time. So, it's interesting that even that hasn't happened, and say, listen, we can't do the pathology on this yet, like until the person dies. But based on all of these things and the medical history of this, we can say this is what the person has. That's not my area of expertise, right? So I couldn't put that together. But it's interesting that there hasn't been a consortium with some group of people who have fought for that diagnosis. So that there would be treatment options for it, right? That opens the door and say, well, we have this new condition that we're now wanting to treat people for and provide care for. What can we do? Right? Like you mentioned before, it's been this hodgepodge of things, from antidepressants to Parkinson's drugs and this, like, what is the best way forward? And that opens the door to cannabis.
Right, exactly. And you know, and that's I'm not I always get on my soapbox for a little bit at Journal Club. I'm gonna get on and hop right off. You know, this is the whole point of why we're doing Journal Club, right? Is because a lot of times the decisions about cannabis, marijuana, hemp, they haven't been made based on science, right? And the information that gets passed out to the public is one that's, you know, more based on some sort of code of ethics, right? Some code of morality from who knows how long ago, who knows who created it, right? But it's science. And you know, when it comes to medicine, when it comes to treating other humans, you know, you got to leave that in the hands of the scientists and the physicians. Yeah. So I'm off my soapbox.
You're off your box.
Yeah.
Now, one of the other things that you mentioned earlier when you were hitting us with the hard science is where the cannabinoids are produced in the brain, right? At the nerve terminals. And it just so happens that the largest concentration of neurons and nerves in our entire body is in the cabeza, in our head, right? And so if you think about the fact that this important system that's being produced at these, you know, specific sites in our body, and they're all, for the most part, in this one area, right? How devastating injury to this area can be to our body, because you're literally destroying the manufacturing home. Like you're literally destroying where this stuff is being manufactured. And if you can't produce it, you know, then you're at a deficit. And lo and behold, what happens when you're at a deficit of something that helps you produce serotonin? Well, you get depressed, right? Because you're no longer getting that signal to produce serotonin, right? Or something that produces GABA, or, you know, inhibits GABA, you know, you'll get anxious or real sleepy, you know, depending on what's happening, right? But you'll get anxious. So yeah, you know, we can look at them and kind of start to draw some conclusions from that. But unfortunately, they've stopped the scientific community from taking that next step to do the kind of work it needs to do to actually present really hard data on it.
Yeah. So I think it's on us.
Let's do it. Let's do it. Well, let's do it. You know, it never stopped us. All right. So I'll let you continue. I'm off the box now.
That's pretty much it. That's pretty much it. So we talked about CTE. We talked about what it was: chronic traumatic encephalopathy, a chronic neurodegenerative disorder affecting the brain that comes from repeated blows to the head. We talked about the fact that it's not just from the NFL, even though the NFL got a lot of negative press. It's not just the NFL, it's any contact sport, any sport that puts you at risk of getting hit in the head, right? Also in the theater of war, another big place where we see people with CTE. Side note, probably very hard to diagnose because of the overlap with PTSD.
Right.
Yeah. Okay. We talked about how you get it. We talked about the symptoms. You've got the neuropsychiatric symptoms, changes in behavior. You talked about the cognitive symptoms, decrease in your overall brain function. We talked about the motor symptoms, decrease in your coordination and speed and things like that. We talked about the juxtaposition of a world-class athlete who can smile for the cameras and do a commercial and then memorize an entire playbook or an entire defensive scheme and then make a superhuman athletic play, right? Reduced to somebody who, you know, can't remember how to drive home, or somebody who no longer has their glowing personality and can no longer do normal things like, you know, tie their shoes. So it's a devastating thing. We only have right now ways to treat it in bits and pieces. And I definitely think that cannabis ought to be one of those modalities that comes to treating CTE until we can do more research and find out a more precise way to treat it. But yeah, does cannabis help with CTE?
Yes, it does.
I give it a yes.
You give it a thumbs up? All right, nice work. Yeah. Nice work. All right, I think we don't have any questions here. We'll give it a second, unless you got questions on your end. I don't have that many.
Nobody said questions. So I don't know. Right. I don't think we got any others in the chat, but that's all I got.
Yeah. All right. Awesome job, man. Awesome work. This video will be live on IGTV Well, it will be posted on IGTV and our YouTube page, and there will be snippets for you guys to consume again or share with your friends if you joined late. So it'll all be available for you. And keep joining us every 2 weeks. Journal Club, presented by my esteemed colleague here and our medical director, Dr. Joshua Moore. So this is where you're going to come to get the best science-based or evidence-based cannabis information. He's literally going through research journals, literally like getting the data and doing that. So that's what he does. He's a subject matter expert. So if you're interested in this and you want to know some more, and you have people in your life that are interested, this is where you can go and get some really good information. So every 2 Thursdays at 7 p.m. and he is going to tell you what our next one is, because I don't have it memorized.
Ooh.
I got it too.
Yeah.
You know what? It's a mystery. Y'all just gonna have to tune in and find out. How about that? Let me putting the brother on the spot.
Oh, no, I got it. The next one is going to be cannabis and chronic pain.
Oh,
cannabis and chronic pain. Yeah,
now that's a big one.
Another big one. Yeah, we got a lot of population getting a bit older. A lot of arthritis. A lot of athletes come to our practice and dealing with chronic pain. So that's going to be a good one. And if you've got any questions about cannabis, medical cannabis, you think it might be right for you, you're interested in getting a consultation for your medical marijuana card, you can book an appointment at our website, drdamas.com. Is it Dr. Damas? It's drdamas.com.
That's it.
And or you can call and make an appointment. You can talk to Diamond, 833-Doc Damas, at 833-362-3262. I think I got it right. Yeah.
Nice and easy. Yeah.
We would love to hear from you. So thanks again for joining us, and
we'll see you in 2 weeks.
Yeah, see you in 2 weeks.